And joining me in studio now just to give us a sense of what more we can do to prepare as the first COVID-19 case has been confirmed here in Kenya is Dr. Lois Ombajo. She is an infectious disease specialist and senior lecturer at the University of Nairobi. Thank you so much for coming in, Dr.
Thanks for having me.
Let's get right into it. In terms of signs and symptoms, I know we've reported on this extensively, but we can't exhaust this enough. If someone is to exhibit these signs and symptoms, what are they?
So the common signs and symptoms, and this we've gotten from learnings from other countries that have had cases, would be fever, having a cough, often it's a dry cough, they may have muscle pains and general fatigue. So those would be the most common symptoms. A few people may have some sore throat perhaps, but the most common symptoms are still fever, dry cough, some fatigue and muscle pains.
Okay, let's get into how it's contracted, because we've been told to wash our hands to ensure that at least we have a hand sanitizer somewhere close. But how does it actually affect us if we are to contract it?
So it's transmitted by what we call droplets. So if someone is coughing or sneezing, you release quite a number of droplets in the air. So if you touch this, if you were to touch a dirty surface and end up touching your face, then of course you're transmitting the infective agent, which are the viruses, to your what we call mucous membranes, your mouth and nose. So keeping hands clean reduces the chance that you're going to carry something dirty onto your face. The other thing would be cough hygiene. So if someone is sick, ideally they should stay at home. So you can imagine a full matatu with someone who's coughing and sneezing. There are probably a lot of droplets released out there. So if you're unwell, stay at home or wear a mask, just a simple tying mask to reduce the number of droplets that are released into the public.
So the mask is more effective for someone who is sick as opposed to someone who is not?
So for someone who is sick, the mask reduces the number of droplets you release into the environment. For someone who's well, if you're going to be coming into close contact with someone who's unwell, you know, maybe family member who you're taking care of, or for us as healthcare workers, you're taking care of a patient who has symptoms, then having the mask for that person reduces the risk that they will get it. At this point, it's difficult to say everybody should walk around using masks, because as you know, there's really a global shortage of masks, and we are almost more than 40 million Kenyans. If we all started wearing masks, they would all run out within a few hours perhaps. So it's not for everybody in the general public. It's for those who are going to come into close contact with someone who has disease, such as healthcare workers, or if you're caring for a close family member.
So once someone has contracted it, you don't start to exhibit symptoms immediately. There's usually an incubation stage of 14 days. So what's happening at that time before you start to sneeze, cough, or anything else?
So if you contract the virus, on average, most people will have symptoms at about 5 days if they're going to get sick. But symptoms can delay up to about 14 days. That's why we have that duration. So during this time, someone may generally feel well, but what's happening is that the virus is multiplying in the areas around the throat, may then affect the lungs as well. So during that period, you won't have any symptoms, but then shortly thereafter, somebody will begin to exhibit the symptoms we've talked about.
So you're still contagious even if you're not exhibiting?
Yes. So generally, it's thought that if someone is asymptomatic, then maybe the risk of transmission is lower, but it can happen. So it's good. That's why we're advocating for somebody who may have come into contact. For example, someone who's traveled into the country should quarantine themselves, even if they're feeling well.
There's been concern as to why it appears to be spreading more among the elderly. Is there a reason for this? And maybe children as well. Is it because of their immune systems?
So I'm not sure it's spreading more, but the people who are older or who have other illnesses that may depress their immunity are more likely to get severe disease. As for children, most of the countries that have reported cases did not report a lot of cases in children, but we know that children can get infected, and for the very young children, they may also end up with fairly severe disease, but we haven't seen too many reports of children in at least the countries that have had outbreaks.
Let's talk about how we need to change in terms of how we interact. You know, we're used to shaking hands or giving a hug. That has to stop, at least for the unforeseeable future. And even when we hear things like self-quarantine, what does that actually mean? What does that look like?
So let's start with the one for how we should behave. So let's not shake hands. It's very difficult. I mean, when I came in, I wanted to shake hands.
I refrained because you reminded me not to do that, right?
It's very difficult because it's our social and cultural norm. But for this period, you want to reduce contact. So we shake hands less. Let's avoid the hugging and kissing and other close physical contact. If you see in many of the countries where they've had outbreaks, they've established what they call social distancing, so that issues like going to the movie theaters, maybe we should avoid that for now, you know, going to public gatherings, going to funerals. I probably want to reduce that for now. We want to reduce any chance that if someone had the virus, you reduce the risk of it being spread to other people. Then we have to learn to clean our hands more. Wash hands with soap and water. That's the most basic thing we can do. If someone has access to sanitizer, then you can use the sanitizer as well. But washing with soap and water is probably the best thing we can do, and do it often. Do it if you've been in a crowd. Do it if you've touched surfaces. Keep washing as often as is feasible for you. When it comes to the issues of quarantine, so the groups of people that you'd want to quarantine is one, if someone has traveled into the country. Initially, we sort of listed a few countries from which you'd want to quarantine people, but now we see that this disease is so widespread that it's probably safe that for anyone coming into the country, stay at home. So quarantine would basically mean that I'm staying at home, I'm reducing contact with people. So in your household, that may mean this is a room for the person who is quarantined. They're not going to go out to the shop, they're not going to go to church, they're not going to go to school. They will stay home, they will monitor themselves. If they're able to take their temperature, that is fine. If they don't have the ability to do so, feel for, am I feeling unwell? Am I getting a cough? Am I feeling feverish? Am I getting a sore throat, you know? Because if that's the case, then they should call for somebody to advise on how to go about it.
Okay, just before I let you go, what is the likelihood of a lockdown? Because we've seen that happen in different parts of the world. If that happens here, what should we be looking out for?
So I guess our hope is that we didn't get to the point of having a lockdown because it's fairly disruptive, as we've seen in other countries where, you know, the public transport system is not working, schools are not there, church is not there. The only way for us to avoid getting there is to actually follow the guidance that's been given by the government. That one, let's really, as far as depends on us, let us avoid public gatherings of any nature. Because if you begin to identify multiple cases, then it means you have to reduce movement of people. When you only have a single case and we're tracing the contacts, and you're saying, you know what, let's not invite more cases, because that will lead to a lockdown where we won't be able to move and do anything. And you can imagine if someone is unable to go to work, unable to go to the hospital, unable to use whatever other social amenities are around. So we really want to avoid getting to that point. So let's follow the guidance given. Let us avoid public gatherings of all nature as is possible.
All right. Thank you so much, Dr. Ombadjo, for coming in and clearing it up as well. There's a lot of misinformation going around on social media especially.
Can I say something about that, please? I think the public enemy number one right now is fear and spreading false information. And I think for everybody out there, let's be responsible for what we post on our social media platforms, for what we discuss in our little small gatherings, because every time we do that, we cause a lot of fear and a lot of panic. And our judgment is not good when we're afraid. So now, while we know what we should do, let's do it. Let's encourage each other to do the right thing, and let's avoid propagating falsehoods of any nature.
Well said. Thank you so much, Dr. Ombadjo.
Thank you.
And as we said, follow the guidelines. It is in our best interest. And